proliferative phase.
Yes, the pictures are a little small, but you can see also there are faint yellow and red dots here. Those are signs of non-proliferative diabetic retinopathy. Later on, it can progress. No? This is actually a proliferative already. So
but as you can see, if it's proliferative, there's already blood, frank blood, no?
Yes.
A lot of blood.
This is hemorrhage already. No?
Hemorrhage, okay. So this is non-proliferative, meaning it's on this side it's still non-proliferative. This is proliferative. Okay, next slide.
This is a bigger picture. No, of,
there.
It's very obvious. You can see blood on the retina, and there are faint red lines here. These are new vessels already, and there's a faint white membrane here. These are already signs of proliferative diabetic retinopathy.
Okay. And as you can see, there's also
exudates. Exudates also. These are hard exudates. Then this can lead to macular edema.
So, Dr. Jimenez, so with this picture, you think the patient can still see?
Yes, especially in this case, the macula looks relatively okay. But anytime the hemorrhage here can spread out and spread out to cover the central part of the retina, and that will cause a sudden drop in the vision.
Okay. So we go to the next slide. Okay. So this is called macular edema. What is macular edema?
Macular edema is swelling of the central part of the retina.
The macula.
The macula. So these are hard exudates. Once you see hard exudates accumulating on the central part of the retina or the macula, it's a clinical sign of macular edema. So when the macula starts to swell or develops edema, your vision also will suffer.
Okay, so we will talk about the treatment later. We're just talking about the types of diabetes and some of the things that happen when you have diabetic retinopathy. Okay, next slide. Okay, now we already went to the types and of the diabetes, the non-proliferative, proliferative. And now we go to symptoms. What do you feel, Doc? What do you feel what does the patient feel when he has diabetic retinopathy?
Well, they rarely feel something. Usually they don't feel anything.
Still clear.
Especially during the early parts of the diabetic retinopathy, usually the vision is okay, it's clear. But later on, you might notice some patches or blurring of areas that are blurred, or distortion in your vision, or dimness in your vision. And that can be a sign of hemorrhages or even early edema or swelling on your retina.
Okay, in the slide it says blurring of vision can be gradual or sudden. So what can cause gradual blurring of vision in diabetic retinopathy?
Well, cataract, diabetes can also cause cataract. So that can be a sample of gradual blurring of vision. For sudden blurring of vision, if you have sudden hemorrhaging, that can cause sudden blurring of vision.
How about retinal detachment? Can it cause sudden blurring of vision or gradual blurring?
Well, if the detachment starts from the periphery going to the central part of the retina, that can cause sudden blurring. That can present a sudden blurring of vision. You can also have the glaucoma as part of the long-term complete retinopathy.
How can you have glaucoma in diabetic retinopathy?
Usually in proliferative diabetic retinopathy, new blood vessels grow into the parts of the eye that are responsible for maintaining the normal outflow of fluid, and if that causes some obstruction, eye pressure goes up, you develop glaucoma.
Okay, so when you see a patient with diabetes, you should really have, when you have diabetes, you should always go to your eye doctor.
Yes.
Okay, or vice versa. If you have, like for example, you have diabetes, you should go often. How often is the follow-up usually for the patients with diabetes?
Well, for diabetic retinopathy, especially, ideally, it can be as frequent as every month.
Depending on the severity.
Depending on the severity of the eye condition also.
Okay, so non-proliferative, probably every 3 to 6 months.
Yes.
And then proliferative, 1 to 3 months, something like that, no? Okay. Well, our discussion is very good. Medyo, it's so fast, and I'm sure our audience are learning a lot. So we tackled on the types and the symptoms and some of the complications of diabetic retinopathy. After the break, we will talk about the treatment, okay, treatment and diagnostic procedures of diabetic retinopathy. So don't go away. Stay right there.
Hands-on Eye, Ear, and Nose Throat Center, located at 066 MacArthur Highway, Angeles City. You can contact them at 045-888-0411 or 045-625-2525.
We're back here in All About Vision. We're talking to Dr. Jimenez. He's a consultant here in Clinica Hands-On and also at the St. Luke's Medical Center. He's a retina specialist, and our topic for today is diabetic retinopathy. We already talked about the types of diabetes, Dr. Jimenez, and the symptoms and the complications. Now we go to how do we diagnose diabetes mellitus. So what do we do, Dr. Jimenez?
You can diagnose diabetic retinopathy clinically by your basic direct ophthalmoscope or an indirect ophthalmoscope. But if you want to get an accurate stage, or if you want to classify it more accurately, we request for a fluorescein angiogram.
Okay. What else?
For macular edema, complications of diabetic retinopathy, we can also request for an OCT.
OCT or an optical...
OCT stands for optical coherence tomography. And we have that here in Angeles City.
Yes, okay. So let's go to the next slide. So this is what is this?
So this is a picture of an OCT. This is an
angiography.
This is an angiogram, fluorescein angiogram. As you can see, when your doctor requests for an angiogram, the patient, we do this while the patient is seated. We take a picture of the eye, and the technician usually injects a dye into the veins, and once the dye enters into the circulation of the eye, the technician takes a picture. It usually lasts about 30 minutes to an hour. And after the pictures are taken, your eye doctor will read the pictures and explain the results to you.
Okay, so this is how they take it, no? There's a camera, fundus camera, the technician and the patient, and the technician can see the eye. This is actually inside the eye already, okay? So next slide. What is this, Dr. Jimenez?
This is an example of a picture of the fluorescein angiogram. As you can see, this is not a normal picture. The white lines here are the retinal blood vessels, and the black area here is the part of your macula. What's abnormal here are the faint white dots scattered all over, and those are microaneurysms, the hallmark of diabetic retinopathy.
So this patient has most likely a non-proliferative diabetic retinopathy. Okay?
Yes, that's right.
If this is normal, there are no dots. We will show you a normal picture later. Okay? So this is how a fluorescein angiogram looks like.
Yeah.
Okay, next slide.
And this is the OCT machine that we use to evaluate macular edema and also detachments. No? Membranes, because of diabetic retinopathy, can very easily be seen with the OCT.
So the fluorescein angiogram takes a picture of the eye.
Yes.
This one takes a cross-section.
Yes.
Takes a view of the
cross-section. It's like a digital biopsy.
Of the
so you can see the layers of the retina with the OCT.
So this is high-tech.
Very high-tech.
Very high-tech. So in fact, we have an OCT and a fluorescein angiogram at the Angeles University Foundation Medical Center Central Zone Eye Diagnostics. So if you ever you want to have your eyes done, we have it there. Okay. So Dr. Jimenez, next slide. Can you explain these images?
So the OCT usually takes a picture of the central part of the eye, which is the macula, as you can see here. The white arrow here is the area of the scanned tissue, and this is the representation of that scan. You can see there are black spaces here underneath the retina. This is the cross section of the retina.
Okay, so
and
this is normal.
This is normal, as you can see. It's relatively flat with a slight concavity here, representing the most central part of the macula. And when you have diabetic macular edema, this one swells up, no? and that can cause